we're going to jump right in and explore a really simple AI technique that could fundamentally change your daily tasks in medicine. I'm talking about a tool that can save you hours, and in this explainer, we'll break down exactly how you can start using it today.
I mean, just think about that for a second. What if you could do all that in less than a minute? This isn't some far-off futuristic idea. It's a practical skill you can start using right now to get back hours of your valuable time.
So what's the secret? Well, it's a technique called zero-shot prompting. And to make it really stick, we're going to use a fantastic analogy. Think of it as writing a one-liner prescription for your AI.
Okay, so what is it technically? It's basically the most direct way you can talk to an AI. You give it one clear instruction. You don't need any examples, no special training. You're just tapping into the massive library of knowledge the AI already has to get exactly what you need, instantly.
And this right here is the analogy that makes it all click. Just like you write a very precise prescription for a patient, you write a very precise prompt for the AI, a clean, single-line command that it just goes and does.
The whole point of this is speed and efficiency. It's all about getting that first draft of a summary, or a list for a presentation, or a patient case study done with almost no effort. This frees you up for the really important stuff, the critical thinking that has to happen next.
All right, so how do you actually write these prescriptions so they work? Well, it turns out there's a really simple, repeatable formula. Let's break it down.
You just have to remember these 4 parts: action, topic, audience, and constraints. So what you want the AI to do, what it's about, who it's for, and any rules it needs to follow. That's it.
Now, check out how beautifully these things stack together. You start with the action, your verb, like summarize. Then you add the topic, let's say diabetic ketoacidosis. Then you make it relevant for a specific audience, like for MBBS students. And finally, you give it the rules, the constraints, in 5 bullet points. See? Each step just adds another layer of focus, making sure the AI gives you exactly what you were looking for.
Okay, theory is one thing, but let's see how this formula actually works in the real world. We're going to look at 3 quick examples, one for education, one for the clinic, and one for research, just to show you how powerful this is.
First up, education. Look at this prompt. It's simple, direct, and it asks for a specific format, a checklist. And just like that, you've got a structured OSCE station ready to go for training. This is a perfect example of how you can create teaching materials on the fly.
Now let's take it to the clinic. Here, the audience is a patient, and the constraints are simple English and a tight word count. And look, the AI immediately takes complex medical info and turns it into clear, simple advice. This is an absolute game changer for patient communication.
And what about research? You know that feeling when you're stuck and not sure where to start? A simple prompt asking for research questions can instantly smash through that writer's block. It gives you an immediate jumping-off point for a paper or a new study.
So this tool is obviously very powerful, but like any tool, you gotta know how to use it right. So let's talk about getting the best results and, just as importantly, what to watch out for. This slide says it all. On the left, a vague prompt like explain asthma gets you, well, a generic wall of text that's not super helpful. But on the right, when you use our formula, adding an audience and constraints, you get a targeted, structured, and way more useful explanation. Specificity is absolutely key.
So you really do have to be aware of the limits here. The AI can spit out generic stuff, the formatting can be a bit wonky, and sometimes it can even make up facts. People call these hallucinations. And if you don't define your audience, the tone can be completely wrong. Which brings us to the most important rule for using this responsibly. You have to remember, the AI doesn't understand medicine. It's just predicting words based on data. So you must verify any critical information, like dosages or protocols, always. Think of the AI as your incredibly fast assistant. It gets you that first draft in seconds, but you are the expert. You always have the final say.
So let's wrap this all up. What's the real payoff for getting good at this one simple skill?
It's really about outsourcing that initial time-sucking work of just getting words on a page. By letting the AI handle that first draft, you lower your own cognitive load. You free up your brain power for the things that truly matter, your clinical reasoning, mentoring students, and focusing on your patients.
The tool's right there at your fingertips, and now you have the formula to make it work for you. So the only question left is, what's the first task you're going to give it?